Is there a particular option that you recommend most in terms of treatment with testosterone? Is it
Oh,
injection, cream, troche?
yeah. So my preferred, I have what I can do through Peak.
Hmm.
My preferred method is the injectable form.
Why is that?
Um, I like it because of compliance, the bioavailability. So compliance, most patients only have to do it 1 to 2 times a week, so it's easy to remember.
Hmm.
Bioavailability is really good, and I feel like there's usually less side effects. Troches are awesome, a nice, really cool alternative. They're considered what we say is sublingual.
Hmm.
They're kind of a pain. You have to hold it in either on your cheek or your inner lip for 10 to 15 minutes. They absorb. You have to do it twice a day. I mean, half of us don't even remember to take our like vitamin D. So it's asking someone to all of a sudden do it twice a day. I tell all patients this. I think there's a little risk factor when you swallow testosterone. I never give testosterone orally.
Hmm.
So when you're doing it sublingual, there's, like I can't say you're not going to get a little bit that's going to swallow.
Yeah.
Um, Topicals, they're okay. They're not a bad route. However, I just from doing this for so many years, a lot of times my patients come back and they're like, I don't notice the difference. They
Right.
are very bioavailable. Levels do get up there, but I just don't see a change in the clinical picture as I do with the injections. And so, I mean, like, I want to be able to give my patients something that's going to work and that they're going to actually get a response to. There's risks to topicals. So sometimes patients get skin irritation. It can change the odor. So I've had patients come back and my wife was like, take that off or I'm not
Hmm.
sleeping next to you. It
Okay.
doesn't happen very often. The main thing I don't like about topicals is that you can get it, like another family member can get it. So really young kids, I get nervous if someone's holding their kids, picking them up.
Sure.
You know, you can transfer it over to your wife. She might feel good with a little testosterone, but sometimes it might not. It's probably the dosing is going to be wrong.
Right.
So say you do it at night before bed and then you have, an intimate moment, you're at risk of giving your partner some of that hormone. So that's kind of how, like, I kind of go down. I'm like, all right, this is my favorite. If you're
Right.
scared of needles, I get it. We can work with the other ones, but I want you to understand, how careful you have to be. You just have to be very careful with it.
Hmm.